If you are over 45, your feet might be showing signs of diabetes right now, even if your blood tests still look normal. Most people live under a dangerous illusion that diabetes is a disease that comes out of nowhere, or that can only be detected when a doctor looks at a piece of paper with your blood test results. You go to the office, get your blood drawn, wait for days, and only then do you get the news. But the truth that metabolic science reveals, and that few patients understand, is that your body doesn't wait for a lab to start screaming for help. Studies show that your feet can give a clear warning, up to 2 years before any formal diagnosis. High blood sugar is like a silent flood in a house. Before the walls collapse, moisture appears on the baseboards, doors start to stick, and the smell of mold spreads. In your body, those baseboards are your feet. If you're over 45 or 50, what I'm going to reveal today could be the difference between a long, healthy life or years of avoidable complications. Pay attention, because this might be happening to you right now, without you even noticing. I see this happen repeatedly. People who reach critical situations or even emergencies showing clear signs in their feet for months, sometimes years. But they simply didn't know how to read what their skin and nerves were trying to say. They thought it was just old age or tight shoes. Today, here at the Metabolic Health Guide, we're going to change that story. I want to tell you about a case I handled recently. A 64-year-old man, very active, who took pride in his health. He came in for a routine consultation, and before we even talked about tests, I asked to look at his feet. He laughed and said, "My feet? They've just been a bit numb lately, but it must be from my morning walk or just the weight of the years." That man presented 4 of the 9 signs I'm going to show you today. When the blood test came back, the result was shocking. His fasting glucose was 210. He was diabetic, and the disease had been corroding his system for at least 3 years, without him knowing. What saved that man from worse complications wasn't the test. It was him finally understanding what his feet were already announcing. In this video, I'm going to show you exactly what I showed him. There are 9 signs that might be in your feet right now. For each one, I'll explain what ordinary people think it is, what's actually happening inside your arteries and nerves, and most importantly, a simple 60-second habit you can adopt today to protect your metabolic health. The International Diabetes Federation estimates that 1 in 4 people with the disease don't even know they have it. There are millions of people walking around right now with a silent time bomb damaging their kidneys, vision, heart, and of course, their feet. The good news is that you can take back control. But to do that, you need to know where to look. If you're looking for real-world, evidence-based tools to finally take the wheel of your own metabolism with total, unshakable confidence, go ahead and hit that subscribe button right now and turn on all notifications. Knowledge is your absolute best weapon against the silent, creeping progression of diabetes. But here's the key. Only after you see the next signs will every piece of the puzzle start to click. Stay with me, because sign number 4 is the one that sends the most people to the operating table, and the last sign is the most ignored of all. Have you ever wondered why diabetes attacks the extremities first? Why not the hands or the ears as often? There's a fascinating and terrifying biological reason for this. Your feet are the furthest point from your heart. Think of your circulatory system as a delivery network. Blood has to travel all the way down to the ground, and then fight gravity to climb back up. When your blood sugar is high, the blood becomes chemically thicker and inflammatory. Now look at this. Imagine trying to pump honey through thin pipes instead of pure water. The furthest and narrowest pipes, which are the blood vessels in your feet, are the first to suffer. Oxygen stops arriving, nerves stop receiving nutrients, and the tissue begins to suffocate. That's why the signs appear there first. If your feet are in danger, it's a warning that your entire metabolic system is under pressure. Let's start with the first sign. Almost everyone has felt this at some point, And almost everyone is given the wrong excuse. Have you ever woken up with that pins and needles or tingling sensation in your feet? That feeling that your foot fell asleep? What do you tell yourself? Oh, I must have crossed my legs for too long. Or my shoes must be too tight. Yes, this happens occasionally to everyone. But here is the vital question. Is this happening frequently, even without an obvious reason? If this has happened to you, pay attention, because most people ignore this sign, and that's where the problem begins. Stop making excuses. We need to talk about what is actually occurring. This recurring tingling, which doctors call peripheral neuropathy, is one of the first and clearest signs that blood sugar is attacking your system. Excess glucose doesn't just flow in the blood. It starts attacking the myelin sheath, the protective outer layer of your nerves. The copper wire analogy. Imagine the nerves in your feet as electric wires carrying sensation messages to your brain. Every electric wire needs a plastic coating, so the signal doesn't leak. When sugar is high for a long time, it acts like acid, corroding that protective plastic. The copper wire becomes exposed. The electrical signal starts to short circuit. It's this short circuit that you feel as tingling shocks or numbness. This was exactly the sign that the 64-year-old man ignored for months. Peripheral neuropathy affects almost 50% of people with glycemic imbalance. It's the most common complication, and tragically, it starts so subtly that people ignore for years, while the damage becomes permanent. If you feel like your feet are tingling for no reason, your nerves are screaming for help. Protection habit 01. If you're over 50 and feel this, my recommendation is a habit of 20 minutes of intentional walking every day. It doesn't have to be a run. The mechanical movement of walking works as an auxiliary pump for your heart, forcing new, oxygenated blood to reach the tips of the nerves, helping to clear excess glucose from periphery. And the most important step, eliminate any liquid sugar from your diet today. Industrial juices and sodas are like poison, injected directly into these already fragile nerves. Up to this point, the signs are silent, but the next one already puts your health at a worrying alert level. We've reached the sign I describe as the most distressing of all. Why? Because it doesn't attack you during the day when you're busy and distracted. It waits for you to lie down. It waits for the silence of the night, when you're trying to rest for the next day, and suddenly your feet feel like they're on fire. Have you ever felt this burning sensation when lying down? Be honest. Many viewers of the Metabolic Health Guide write to us saying, I thought it was because I stood for too long, or I thought it was the summer heat, or just exhaustion. But if you feel a persistent burning in the soles of your feet, especially when lying down, pay close attention. This is a classic sign that diabetic neuropathy is advancing. The faulty alarm analogy. Imagine your house has a fire alarm system. The sensor was damaged by an electrical surge, and now the alarm goes off by itself in the middle of the night. There is no fire in the house, but the noise is real and deafening. That's exactly what happens in your feet. The nerves have been so battered by high sugar that they start sending false pain and heat signals to your brain. Your brain receives a message of intense heat. Even though nothing hot is touching your skin, your nervous system is short-circuiting, crying out for help. Research published in the renowned journal Diabetes Care shows that this nocturnal burning usually appears 1 to 3 years before a formal diagnosis of type 2 diabetes. In other words, your feet are trying to give you a window of opportunity to act before the damage is irreversible. Protection habit 02. There are 2 fundamental habits here. First, strategic hydration. You must drink at least 2 liters of water a day. Water helps the kidneys filter and expel excess glucose, decreasing toxicity in the blood that bathes the nerves. Second, add fiber to every, and I mean every one of your main meals. Oats, Green vegetables and legumes act like a sponge, slowing the entry of sugar into your bloodstream. This gives your nerves a break from suffering constant glucose attacks. Now, let's talk about the opposite of the burning sensation. Persistent cold. Are you that person who needs 3 pairs of socks, even in the summer? Or do you feel like your feet are freezing while the rest of your body is warm? Many say, "Oh, I've always had poor circulation," or "It's genetic." But here's the detail no one tells you. Persistent cold feet are an indicator that your blood vessels are becoming stiff and narrow. The heating system analogy. Think of your blood vessels as the heating pipes of a house. Warm blood is what maintains the temperature of the extremities. When diabetes starts damaging the artery walls, they undergo a process of stiffening. It's as if the hose carrying water to the end of the garden is seriously kinked. The water, the warm blood, is there at the beginning, but it simply doesn't have the force to reach the tip. If the heat doesn't arrive, the tissue cools down. This isn't about the weather outside. It's about the state of your internal piping. The American Heart Association warns that diabetes is the main risk factor for peripheral artery disease. If your feet are cold, your arteries are calling for help. Protection habit 03. The best medicine here is intentional movement. If you can't walk long distances, do heel raises while watching TV or sitting down. This helps pump the blood back up and challenges the arteries to stay flexible. Don't ignore this, because what comes next is what turns discomfort into a reality check. We now come to the sign that concerns me the most as a health content creator, because it is the one that sends the most people to the operating table. It's the point where discomfort turns into a real, life-threatening danger. Pay attention. Have you ever had a small blister or cut that just stayed open for weeks? Many patients ignore this, thinking it will close eventually. But if your sugar is high, your body loses its healing capacity. Most people ignore this sign, and this is where the consequences become dramatic. The interrupted healing cycle. For a wound to close, your body needs to send a repair crew, white blood cells to fight bacteria, and oxygen to rebuild tissue. But when sugar is elevated, the blood vessels narrow so much that the repair crew gets stuck in traffic. They can't reach the site of the wound. Furthermore, sugar-rich blood is the perfect environment for bacteria to grow. It's like throwing a feast to the enemy, while your defenses are paralyzed. The CDC reports that over 100,000 amputations per year in the United States start exactly like this, with a small foot wound that was ignored. This was exactly the sign that almost took away the mobility of that 64-year-old patient I mentioned. Protection habit 04. This habit could save your leg. The 60-second exam. Every night after your shower, sit down and examine your feet with a flashlight. Look between your toes and under your heel. If you find any cut, blister, or red area that wasn't there, treat it immediately with antiseptic. And if it doesn't improve in 48 hours, see a doctor. In diabetes, 48 hours can be the difference between a bandage and surgery. Have you noticed that the skin around your ankles or on the top of your feet is getting darker, reddish, or even a bluish tone? Many people look at it and say, "I think it's a sunspot," or "My skin is just getting old." But here is the pattern break. This is not common pigmentation. It's a visual sign that blood is stuck or that the tissue is suffering from a lack of fresh oxygen. The suffocated plant analogy. Imagine a plant that doesn't receive adequate water and nutrients. The leaves don't just wilt, they change color, turn dark, and lose their shine. Your skin is the organ that shows what's happening inside. When sugar-laden blood damages the tiny capillaries, blood leaks into the tissue, causing this darkening. In more severe cases, the skin becomes thin as tissue paper, shiny and fragile. Dermatological studies show that these color changes are detectable about 18 months before a diabetes diagnosis. In other words, your skin is painting a warning for you. Have you seen any spots like this on your feet? If this content is helping you, subscribe and turn on notifications. I'm going to show you the signs and what's happening inside your body. I've also left a link in the description and in the first comment, explaining what's really causing this and what you can do starting today. But don't click it yet. First, you need to understand sign number 9. Protection habit 05. Do ankle circles and calf stretches every morning before even getting out of bed. This wakes up the circulation and helps the blood pooled in the ankles return to the heart. Also, if you sit for long periods, use a footrest to elevate your feet. Gravity should be your ally, not your enemy. Many of our followers here at the Metabolic Health Guide tell us, "My heels always crack in the winter. It's just the dry weather." And indeed, the weather has an influence. But pay close attention. If you use expensive moisturizers, drink water, and yet your heels look like a cracked desert, or if this happens in the middle of summer, the problem isn't external, it's internal. High blood sugar attacks, what we call the autonomic nervous system. This is a system that controls everything your body does on autopilot, like your heartbeat and, yes, producing the moisture and sweat that keep your skin flexible. When these nerves are damaged by diabetes, your feet stop receiving natural hydration from the inside out. The brick wall analogy. Imagine that the skin on your heel is a brick wall. For the wall to be strong, the mortar between the bricks needs to be moist and firm. When diabetes attacks the nerves, it's as if the mortar dries out and turns to dust. The wall starts to crack. The real danger is aesthetic. It's that these cracks are open doors for bacteria. In a foot with poor circulation, a deep crack can turn into a bone infection before you even feel pain. This might be happening to you right now without you feeling any pain at all. Protection habit 06. The secret here is double hydration. Every night, apply pure coconut oil or urea-based cream to the soles of your feet, but never between your toes. And most importantly, drink water as if it were medicine. Your skin needs to be hydrated from the inside out so that those nerves have a chance to recover. Now we enter the signs that indicate real danger to other organs. Have you ever taken off your socks at the end of the day and noticed that the elastic left a deep groove in your skin? Or notice that your feet feel puffy and heavy? Many blame a tiring day or the heat, but constant swelling, which doctors call edema, is a sign that high sugar has started to overload your kidneys. The kidneys are your body's filters. When the blood is thick with sugar, these filters get clogged. The fluid that should be expelled finds no way out and, due to gravity, ends up accumulating in the feet and ankles. The filtration plant analogy. Imagine your city's water treatment plant. If the filtration grids get clogged with debris, the water starts backing up through the pipes and leaks into the lowest parts of the city. Your ankles are that low part. The swelling is your body saying that the renal filtration system is under severe stress due to high glucose. Have you noticed that sock mark on your ankle today? Protection habit 07. Reduce sodium consumption immediately. Salt is the best friend of fluid retention. Additionally, when you get home, lie down with your feet elevated above heart level for 15 minutes. This helps drain the fluid back to the center of the body, relieving pressure on your kidneys and blood vessels. This sign is often confused with just some pool fungus. But why would the fungus attack you and not someone else? Because diabetes changes the chemical composition of your sweat and skin, making your foot a fertile ground for infections. Additionally, the nails become thick, yellowed, and difficult to cut because the blood supply nourishing the nail matrix is compromised. If your nails have changed in texture and color, your metabolism is sending a visual signal that nutrition isn't reaching the extremities. And this is where most people go wrong. They try to treat the fungus without looking at the glucose. Protection habit 08. Keep your nails cut straight across, never round at the corners, to avoid ingrown nails, which are doorways for infections. If you notice persistent fungus, see a podiatrist and ask for a blood glucose test. Often, the fungus is just a symptom. High sugar is the cause. Pay attention now to the last sign, the most silent and invisible of all. This is the sign that almost no one notices, including many health professionals. Look now at the top of your feet and your ankles. If you used to have hair there and it just disappeared, leaving the skin shiny and smooth, pay attention. Hair follicles are like small plants in the garden. They are extremely sensitive to a lack of oxygen. When blood circulation decreases due to damage caused by sugar, the body shuts down what isn't essential for survival. Foot hair isn't essential, so it dies first. The body's message. If blood can't keep a simple hair alive, imagine the difficulty it is keeping your nerves and tissues healthy. The absence of hair is a marker of peripheral vascular disease, strongly linked to long-term diabetes. It was exactly this detail that confirmed the diagnosis for that 64-year-old man. We covered 9 signs today. 9 chances your body gave you to act before the worst happened. I want to be very sincere with you who follow the Metabolic Health Guide. The hardest part producing this content is knowing that many people will only value this information when they are already facing a serious complication. But you are different. If you made it this far, you are seeking knowledge and prevention. Don't ignore what your feet are saying. If you identified at least one of these signs, it's not a coincidence. Your body is already warning you. Most people only find out too late. You still have time. Comment, I saw it down below. I want to know who is truly paying attention and committed to their own health. This small gesture is your first step of commitment. The 30-second challenge. Tonight, before you go to sleep, take 30 seconds. Not 30 minutes, just 30 seconds. Look at your feet. Use what you learned here. If you find something, don't panic, but take action. Schedule an A1C test. A simple test can change the entire trajectory of your older years. You worked hard your whole life to enjoy your retirement, your grandkids, and your freedom. Don't let a silent disease take that away from you, just because no one taught you where to look. Now you know. If this guide was helpful, click the like button and, more importantly, share this video in your family group or on Facebook. You might be the person who saved the foot or the life of a friend or family member today. Subscribe to the Metabolic Health Guide so you don't miss our next weekly conversation on how to shield your health after 60. If you want to understand what's actually driving these symptoms and what people are doing to regain control naturally, there's something in the description that walks you through it. Which of these signs are you going to check for tonight? Let me know in the comments. I read and reply to as many as I can support you. Your health is your greatest asset. Treat it with intelligence. We'll keep uncovering the secrets to an unshakable metabolism right here at the Metabolic Health Guide. See you in the next one.